All right, day 24 of the 27-day mobility challenge here at the Reprogram, and we're continuing on with our essential movement templates, these standards, this screening tool that I'm giving you so that you can assess the health of your joint range of motion, the compensation space. Okay, and this space can be the difference between a muscle strain and a complete tear. We minimize the degree of injury and we're minimizing the risk of injury. All right, so today we are talking hip extension. This is a subject very dear to my heart. I could go on for ages about hip extension, but I'll try and simplify the basics down for the purpose of this video. Now, this is probably, out of all the screening tools I've given you, this is probably the number one screening where people are just awful. Like most guys I have in here, or clients I see, any athletes that I've seen through my history in this industry are shocking in hip extension. All right, and it is mainly due to the fact that we are more sedentary nowadays than active. We are no longer spending our days walking up hills, farming, etc., bending over, picking stuff up, extending, pushing a plow down a field, right? We are sedentary. We are spending most of our day sat down. And even if you are physically active, you are probably only really active for a couple of hours max a night, right? Or in the morning, okay? And it's just not enough in terms of getting the volume of that range of motion, this hip extension range of motion in to maintain hip health. So we have to be diligent, we have to be disciplined with it, and we have to purposely be on the ball, if you like, with hip extension, with this range of motion. So to try and keep it as basic as possible, as I said, what happens is if we are sat down for too long, we get very tight in the hip flexors, all right? These muscles that allow the leg to lift, and these also attach through to the knee. Now what happens is, a lot of times when we're at work, we're working for someone. We have a time limit, we have tasks to do, we have delays, we have stress, and it causes a lot of stress, plus the general stress of life, right? And what happens is when we are sat in this position and we're getting all stressed out, and this happens over time, this chronic stress response, what happens is that our bodies learn to contract these muscles in this shortened position, because when we do get stressed, we get the muscles that activate first. If we take it back to the fight or flight reflex, where we're running away from the saber-toothed tiger, if you like, the metaphorical saber-toothed tiger, we get a massive influx of blood rush and activation into these quads, these big, powerful knee extensors, and that allows us to kind of get up and run away, like react quickly. But if that same mechanism is triggered over and over again when we're sat down, of course, these muscles are going to be activated, getting more and more tense, but they're not moving. They're just maintaining the short flexed position, and of course, we get that adaptive shortening. Now, over time, what happens is that makes the glutes weak. It inhibits the glutes because we never actually access that extension to run away from the saber-toothed tiger. We're just sitting there, right? Just cooking in our own stress. And then, of course, because we lack that extension capability, we see all these symptoms like arching anterior pelvic tilt or excessive anterior pelvic tilt, tight hamstrings, overly active or short hip flexors, as just mentioned, and that all leads to that gluteal inhibition. If the glutes are off, we get overactive piriformis because there's now no muscles to extend the hip actively. Those big drivers, those glutes that actually propel us forward, aren't really working very well anymore. So we need the other muscles to compensate, which is most likely the posterior fibers of the gluteus medius and the external rotators. And then when they get overcooked, we get things like piriformis. And then that changes the whole mechanic of how our hip works. We get bursitis, hip impingement, and the same old injuries crop up again. SI joint pain, lower back, and particularly patellofemoral pain, and particularly these signs of this like lower back arch. If you can imagine, if I can't actually extend my hip back past the midline, if you imagine I've got a straight line drawn down the side of my body and it goes right through my hip, and I'll show you in the demonstration a bit, I can't actually extend the hip back past that midline without my lower back arching. So a lot of people are living in this permanent arch, and we end up using the erector spinae muscles to actually try and help extend the leg behind us to generate momentum going forward. Okay, so this is a massive, massive issue. It causes so many problems, and particularly when it comes to rotation as well, it offsets the whole biomechanics of the hip. And a lot of times, if it doesn't get addressed as we get older, these are the guys who end up getting osteoarthritis, hip replacement surgeries, and getting tendons and tissues cut to create space to release the sciatic nerve and things. And all they had to do was freaking stretch their hip or mobilize their hip earlier. They just needed to be told, right? So hopefully you guys out there who are super tight in extension get this video first before you go to see a surgeon, and you make a life-changing decision. Okay, so the test we are going to do today is a hip extension test. It is a modified version of it's a combination actually. It's a modified version of the Thomas test and the Ely's test. Okay, now that doesn't actually matter. Doesn't matter what they're called. What we're doing is we're testing for extension, or a limited extension. Okay, so I will show you that now. All right, so this is the modified version of the Thomas test plus the Ely's test. And all we're doing is we're testing hip extension on a global scale, okay? So traditionally what would happen is I go to the physical therapist, he'd have me lie on the bed, or the plinth, whatever you want to call it, like this. And if I was testing this leg, he'd have me lift this knee up, and he'd let this knee drop off the edge of the bed. So this foot would just dangle off the bed. And what he's checking for is if this knee can't actually rest on the bed, which would mean I'm very tight here. You might bend the knee to exaggerate that extension position, or he'd look for a knee coming out this way, which would indicate tight, like tensor fasciae lata, lateral compartment, iliotibial band, etc. Okay, so that would be the Thomas test. The Ely's test would be a passive test where he'd have me lie on my front like so, and he'd just basically flex my knee all the way, bring my heel to my butt, and check that I'm not arcing or anterior tilting, lifting the hips up, which would indicate another shortness, passive shortness, tissue shortness in those hip flexors. So what we're going to do today, as I always say at the Reprogram, we like to go one better, and we're going to combine those two movements into one brutal position. Okay, now some of you might know this as the couch stretch, but it is the best way to test hip extension capacity. It is just absolutely brilliant, and it will basically, I think it will humble a lot of you guys out there. So we're going to do it in two stages, because a lot of the time most people can't even get the first stage right. Okay, so here's what you do: get yourself a mat so it protects your knees. Find a wall, and you are going to bring your leg, back leg, or whichever leg you want to test, flat to the wall. Knee back to the wall, foot against the wall. Okay. Now from here, you are going to bring the front leg up. Okay, so the first position we're looking for is a straight shin, a straight tibia here, and then the hand level with the foot. Now what your goal for the first stage is to get a straight line from the shoulder, hip, and knee. So if you get to this position and you're like this and you can't go anymore, that's a big fail. That would indicate you are missing a lot of hip extension in those tissues. Because what we really want to look for in terms of healthy hip extension is the ability to bring this hip down to that 180-degree line, or a straight line coming down here, ideally a little bit more, and squeeze that glute to demonstrate that you can activate that gluteal muscle in that max hip extension angle. Okay, that's very important, because particularly today we're seeing a lot of lower back pains or lower back issues where they have no gluteal activation in that hip extension, and the only muscles left to try and get that hyperextension, should I say, is these erector spinae muscles in the hamstring. So we end up getting overuse on these two compartments which are not designed to do it. Okay, so from here we're going to lock that hip, and then you're going to bring yourself up to the second stage, where you could say this is like the Ely's version of the test. That full knee flexion, full hip extension, keeping that squeeze of the glute, and then you're going to feel a big stretch here, and that is a pass, okay? And like I suggested before, a fail would look all kinds of things, all right? So some people can't even get this front foot here, they'll be back here, they'll be falling out to the side, you'll be trying to bring this foot up like this, okay? And you're just trying to even struggling to get this first position, but don't worry, because that's just where you are, right? Well done for starting. You've just found something in your body that could save you a bunch of problems later on in life, okay? Another fail would be that you just can't get up because you're so tight here, you can't actually get up onto this front knee. And yeah, so that is the hip extension test. All right, the modified version of the Thomas test plus the Ely's that we use at the Reprogram to screen for adequate hip extension. Thank you for listening. If you like what you're hearing and you like what I'm doing and you want to see how I can help you, or you are in pain and you want to see what's going on, go to the Reprogram, www.thereprogramonline.com. See you tomorrow. Check this out.
Hi there, I'm Andrew Graham, founder of the Reprogram Online, and if you're here, it's likely because you are feeling the frustration of a body that just isn't performing the way it used to. Maybe it's a nagging joint pain, the frequent injuries, or the simple truth that despite all your efforts, you're not seeing the results you desire. As a busy professional, I understand how valuable your time is. You want a body that not only performs well, but one that you can enjoy and that you know is capable of handling whatever life throws your way. Yet, finding the right path in today's fitness industry is like navigating an untamed jungle of misinformation, quick fixes, and empty promises, often leaving you frustrated or worse. That's why I created the Reprogram, a comprehensive training system designed to not only build a strong athletic physique, but to do it in a way that prioritizes injury prevention, joint health, and longevity. By merging concepts from physical therapy and strength and conditioning, the Reprogram targets and alleviates the very issues that are keeping you from moving forward. Starting with our free mobility assessment, we will identify these issues, as well as your potential risk of injury, and design your training program based on your results. You see, many people think they need more, but often what they really need is better. It's not about lifting the heaviest weight or doing endless reps. It's about focusing on what truly matters so that you can build a body that's not only aesthetic, but resilient. A body that works with you, not against you. The Reprogram is built for men who understand that their body is their most valuable asset and who refuse to let joint pain and past injury dictate their future. Using the 3-stage training system, you'll regain your mobility, correct muscle imbalances, and improve your posture, all with minimal equipment. I mean, imagine your life where you're not just managing pain, but actually eliminating it and getting stronger every day. Believe me, I understand the frustration of trying to stay active when your body seems to resist every step. But with the right approach, that frustration can quickly turn into fuel for change. The Reprogram is designed to respect your time and deliver results in a way that actually teaches you about your body. So, are you ready to break the cycle and unlock your potential? Then I invite you to start your journey today. Remember, this is about you, investing in your future, your health, your quality of life. Click the Get Started button to begin your free mobility assessment. I'm Andrew Graham, and I'm here to help you banish pain, optimize mobility, and unleash strength one step at a time. Let's get started.